Guru. How are you doing today? It's been a little while since I've done a live related to anything. You've seen, hopefully, the interviews I've done with people, clinicians covering different topics. I'll have one coming up, hopefully, in the next couple weeks as well. Uh, Very interesting set of topics. But I did want to talk about something specifically today. But before I get into that, I know that for many of us, we're getting ready to have our licensure renewed. And as such, if you're like me, you tend to wait to the last minute to get all your continuing education in that you are required to have. If that is the case for you and you don't have a home yet for getting your continuing ed, may I suggest alliedhealtheducation.com or alliedhealthed.com. Allied Health has over 300 courses available for all rehab professionals. I happen to teach several for them. And if you get an all access subscription now, you will get 15% off if you use the promo code RDG 2024. That will give you 15% off. And just as a reminder, all of the courses that I teach, a full 20% of net profits go to Reese's Rainbow, which helps people with special needs get adopted. So it's a wonderful organization. So what's the topic for today? Well, there was a recent report that came out from the federal government related to Medicare Advantage and some of the problems that they're seeing with Medicare Advantage claims not getting paid. And not only that, but blocking, sorry, hopefully that won't mess up the video, incoming call. Blocking of prior authorization for people that need care. So more specifically, they talked a lot about Humana and United Healthcare. So Humana and United Healthcare, as you know, do manage Medicare funds through Medicare Advantage. There are other plans, but they're two of the biggies. And what they were finding was that these two entities, by increasing the use of not only AI for doing specific word searches within a claim that was submitted, but also by altering the sensitivity of the AI, either denying or accepting, they could either increase or decrease the number of denials. And what they would do is obviously, AI, as it's used, typically looks for keywords that are utilized. And if you don't achieve those keywords that are in their policy, that's a fairly easy claim rejection. And it appears that you can tell when an AI was the one who reviewed your claim because you'll get a very fast turnaround on your prior authorization. Like if you've sent a boatload of documentation for them to consider and you get like a turnaround 24 or 48 hours, probably that was an AI reading your claim submittal. But what they found also was these Medicare Advantage plans, Humana and UHC specifically, were making it so that they were incentivizing, if they had high volume and they wanted to reject more claims, they could kick those to the reviewers with the AI already suggesting to the reviewer, this will be a claim denial. Making it pretty clear that it rejected it as not medically necessary. And then the reviewers, who frankly don't review a boatload of the paperwork we send them. In fact, I read one comment from a doctor saying that as a reviewer, his productivity, and we're talking about surgery prior authorization, his productivity was expected to be something like 12 claims per hour. So think about that. That is what, 5 minutes per claim. You're supposed to go through it to make sure that it's valid and then make a determination within 5 minutes. And that's just insufficient. And so UHC and Humana were found to be altering the sensitivity to cause additional denials. And so this was a report that just came out from the federal government. I wish I had written down the name of the report, but one of the things that I'm personally trying to work on with my organization that I work for is how do we overcome the limitations set by artificial intelligence? One interesting thing, you may or may not know this, and you probably aren't surprised by this, but there are a couple significant companies that have popped up that do artificial intelligence generated appeal letters. And somebody quipped that could it be at some point we'll have AI rejecting a claim and then AI writing the appeal? It's just them going back and forth. And that kind of makes me sad. For one thing, AI is still a long way off from being 100% accurate. But even if you had an internal to your company only AI that could only draw data from internal sources rather than the net as a whole, the level of sophistication and, let's say, creativity for an AI thinking about alternatives in argumentation is just not there yet. And so some of the most successful appeal strategies that I've developed or helped develop for my company have involved going out the very base, going beyond the basics of what we know in the policies and the literature, because I, as a human being, possess creativity and can draw parallels in ways that AI cannot presently. Now, will it be able to someday? Perhaps so, and that's a little bit scary. And it's scary in the sense that will we eventually, as human beings, abdicate our creativity, our critical reasoning skills, etc., to artificial intelligence? Will that happen at some point? And therefore render, for instance, you as a clinician, you incapable of writing your own cogent, solidly argued documentation for medical necessity? Will it render ineffectual and unnecessary people like me who are on the appeals management side and letters of medical necessity? And at least right now, it does appear that that's not the case, but maybe we'll get there someday. So again, check out the report. Again, I don't know the title, but it just came out, and so it should be fairly easily searched. It is about Medicare Advantage plans and Humana and United Healthcare causing automatic denials. And so I think it's called Refusal to Reimburse or something like that. That comes to my mind. Anyway, hope you're doing well. Thanks for joining me.